All right, you have joined us live on Facebook Live. We are joined now by Dr. Gordon with Think Whole Person Healthcare. We had been hoping, and we still are hoping, to have two medical experts joining us to answer your COVID-related medical questions here. And it looks like Dr. Quimby just popped up, so he's with CHI Health. Thank you so much for joining us as well. Dr. Gordon, I was mentioning, Chief Medical Officer with Think Whole Person. Dr. Quimby, we really appreciate you joining us as well. We had a couple issues getting things going, but it looks like we're all ready to go. So we are now live on Facebook and people can begin asking questions. In the meantime, before we see any popping up, I have gotten a couple from viewers that I'm gonna just ask at this point. One is, someone wrote into me on Twitter saying, what about backyard parties? For example, we have Mother's Day coming up. Of course, it's springtime, weather is much nicer. Is it okay to have kind of these driveway or backyard parties if you're staying 6 feet apart? What do you think is the medical advice on this? And we will say that the 10-person rule still exists in the state, but in terms of a medical standpoint, if you're spacing apart, is that wise or still hold off? Dr. Gordon, do you want to take that one?
You bet, and I'd love to hear Dr. Quimby's input as well. You know, my recommendation would be to maintain social distancing and practice that where we can, do virtual family get-togethers and continue to flatten the curve. We know that based on the information released, Nebraska does show continued increase in cases. But we are also certainly doing more diagnostic testing as well at this point in time.
Dr. Quimby, yes, I'll leave it to you too. What is your answer to that if someone were to say, what should I be doing right now in terms of those parties?
My answer to that is what is making my kids currently unhappy, is that there's the best of intentions that sometimes fall through. Like, yep, we're all in the backyard, we're all staying far apart from each other, and then somebody needs to use the restroom or wants to go inside to get a drink, and all of a sudden your attempted distancing has pretty much gone away. So if you are out and about, there can be just issues with attempted distancing not going through like you hoped it would.
No, that makes sense. I have young kids and, I have to think of that, of some of the things we're planning to do, even going to the park and things like that. When it used to be, maybe if someone needed a potty break on our bike ride, we could stop off at a restaurant. We now have to think in advance that that's not something I want to do with the 3 and 5-year-old who don't maintain social distancing in public places as hard as we try. So that is important to think of, the bigger picture. Karen just wrote in on Facebook, in Lincoln, Nebraska, we are growing in COVID-19 patients every day now, and they're talking about opening things up. What do you think about this? So, some of these are the opening things up questions are obviously more political government decisions there, but if you would care to weigh in on that of where we stand now in Nebraska, do you think we should be opening things? Do you think we should be out and about more? Dr. Quimby, do you want to start?
Part of the increased cases is due to testing, because we are able to test more than we were, say, 2-3 weeks ago. But there are clear areas where there's actually a whole lot more cases than there were before. For example, up in Schuyler, and central Nebraska is still having their problems. To me, it depends what you mean by opening up. For example, some hospitals are starting to allow medical procedures that were temporarily put on hold for a while. And if done safely, where you're not pushing your hospital capacity, that can be important, because I haven't needed a joint replacement. I've seen a lot of people who need joint replacements, and they can be fairly miserable while they're waiting for it. And putting off cancer screening by endoscopies isn't a great idea either. So in terms of that opening up, that can be done safely. As far as the restaurants and public places, that is currently at the health department and governor's discretion.
Dr. Gordon, do you care to weigh in on that one?
I concur. At this point, I think nothing additional to add there. I concur.
Sure. I have one that is kind of, I guess, one that comes up in our household a lot. My husband has pretty severe allergies when he's out doing yard work and whatnot. Like I said, we have young kids, so sometimes they're sneezing and all of that. And I keep thinking, right now it's one of those where everyone is highly alert to any changes, even cold symptoms. So I'm sure you've been asked a lot, but how do I know if it's the common cold, if it's allergies? What are you telling people who aren't sure what they have? What should they be looking out for to know that it's more likely to be COVID-19? Dr. Gordon?
The CDC mentions at minimum, if you're experiencing cough or shortness of breath or difficulty breathing, you may become concerned that you could have been exposed to COVID-19. But they also recommend looking for at least 2 additional symptoms, such as the new loss of taste or smell, certainly fever, chills, repeated shaking with chills, muscle pain, headache, and sore throat. And so while you may experience what feels like a sore throat with allergies due to postnasal drainage, if you're uncertain, that's where telehealth visits are important. It allows you to maintain a safe distance and not expose others if you are at risk. Certainly, multiple health systems, including Think Whole Person Healthcare, offers telehealth visits. And if you're unsure, engage with your provider through telehealth visits and get your concerns addressed right away.
Dr. Quimby, I have a question for you. I've been hearing from some doctors I know that they're seeing actually fewer people are coming in for treatment of other things because they might be concerned to go see a doctor right now. Is that something you're seeing? And what would you say to anyone who might have a health condition that they're hesitant to get help with at this point?
I can only talk about with direct knowledge of my own patient panel. And I have had some people want to delay visits because of concerns about coming in. I can mention that at our CHI clinics, we're screening people before they come in. And if there's anybody who flags positive on various criteria, they're not just put in the general waiting area. So it should be safer to visit our clinics than random grocery store, gas station, or I thought I read that Nebraska Furniture Mart's opening up, not making fun of them, just a large store. So it should not be a health risk to go to the doc. If you do have concerns, for some things, telemedicine visits are appropriate. For some things, it is not. For example, I do infections, so that involves a fair amount of wounds. It's a little bit difficult for me to probe into a wound over Zoom. So that is something that would need to be in person. If you have routine heart issues and things like that, and you don't have them addressed, you could have declining health in the future. And there have been reports of less people with heart attacks showing up in the emergency departments, which probably doesn't mean there's less heart attacks, just less people are showing up, which can have long health term problems. So go, it's safe.
Yeah, sounds like at the very least, make that first phone call and talk to someone at the physician's office to get their opinion of, can telehealth fix this, or should I go somewhere else? And right, if you're having a heart attack or you think you may be, that is the case where you're still supposed to go to the ER. You need to get that taken care of immediately, for sure. Dr. Gordon, as you see patients, are there any questions that kind of stick out to you that you get asked more than others when it comes to COVID-19? What do you think are the concerns that are out there?
I think the concerns that we've all heard, both through the media and in person, reflects, will I be immune if I get sick? How will I know if I have it? If I've had it before, does this mean I can have it again? Those questions are still out there for our patients. Can I take those medicines that were mentioned that I heard about on the news? I think it's important for patients in this time that is clearly very scary as a consumer and as a patient in any healthcare system to talk with a healthcare professional. Professionals such as Dr. Quimby, who is an infectious disease specialist, and myself, I'm a family physician. We have the information and knowledge needed for you for our patients, for our viewers who may have questions. I encourage you to contact a healthcare professional. Sometimes the information that is provided over the internet in non-reputable places can be misleading and result in unintended injury.
Definitely important information, and hopefully, right, if you're getting information from any news sources, they can cite where they're getting the information, whether it be from a medical professional, whether it be from the CDC, and that's very important, right? I mean, here we are on Facebook, but we say in general, you shouldn't be getting your news just from a comment on Facebook. Make sure it's cited and it comes from a person in the know. Dr. Quimby, going to ask you about masks right now. So, you know, it started early on, right? We have it in Tupperware. That's part of the question. So it started early on where we had been hearing we don't need to wear these, and now we should to protect the people around us. First of all, if anyone is still skeptical of the mask, how do you explain to someone how this works? Why is it important?
Well, there was one meme that I got sent to me that I will not mention here, but it explains it fairly well.
I think that was my favorite meme. I think I saw it, okay, and I loved it.
Yeah. So I will just say, if you are wearing a cloth mask, that is probably not doing a lot to protect you, but it does help the people around you. So if everybody does it, you get protection. If you're the only one not wearing a mask and everybody else is, you're getting protection, but you're not helping out other people, which is the same kind of thing with vaccinations. You need enough people to do it for it to be useful. Except the vaccine actually protects you alone. If you have a medical grade mask, that can help protect your initial exposure up to the N95, N99s, and N100s that prevent really small particle entry. But if somebody's not used to wearing those N95s and above, they can be very difficult to breathe through and very uncomfortable, and only really needed for known exposure areas. So if everybody wears it, it might help out the whole population, but everybody got to do their share.
Agreed.
Yeah, you know, this comment just came in from Sherry, and she said, I wear my mask everywhere I go. It just makes me feel better knowing I'm wearing one. And I have to say that, you know, we were talking about it in the newsroom yesterday. I don't think anyone really likes to wear a mask. It's not like people are seeking this out, like, can't wait to wear one. So it's not that, I guess in some ways you're not unique if you don't really like it. We're still supposed to do it, and it's something you can do for those around you. It's just this small inconvenience we all can do for peace of mind for people and helping with their health as well. You know, I saw you had the Tupperware, and that brings up too, you know, I laid mine on the table. That's probably not the smartest thing to do, right? So what should we be doing to make sure we're keeping these masks in a way where we're not then picking it up and putting it directly by our face?
Well, if you have a cloth mask, you can put it in the laundry. And what I'm doing for masking, because I'm in a hospital with a bunch of people, is a little bit different than what people out and about in the real world are doing with masking. Because I have mine on all the time, from other than when I'm on a little computer screen here. But I might want to do something like take a drink, okay? So I need to do something with my mask. The outer surface that's been exposed to the outside of the world is considered the dirty side of the mask. So I need something to do with that. I can put it on a paper towel, which is what a lot of people do. And if I have one location, like I'm on only one hospital floor or I'm in one clinic, that's fine. And then you control the little ear loop straps to make sure they're not getting all over the place. But I'm in various places. So I basically just need a place to ditch it when I take a drink. And that's why I got my little Tupperware.
Perfect. Dr. Gordon, with that too, I was noticing, you know, I've even seen, not to call out some national reporters, but I have seen some national reporters where they take it and it's maybe down here then, or you see it where they put it up here on their forehead. You know, if you're not going to wear it, if you have to take a drink or something, what do you do? Because what's happening if you put it down here or right here?
You know, when I take a drink, because actually within our clinic, I've required that all employees wear their masks during their workday. And so recognizing that folks will need to take a drink, I've just recommended that they remove the one ear lobe so it's still attached, take the drink and replace it. So I'm not having them take it completely off the face to set it down on a surface where it could become contaminated. And so that is what I've had folks here practice.
Small children, we know it could be a choking hazard for certain ages. I think they're saying not 2 and under should not be wearing a mask, but really something you recommend for children older than that then too?
Absolutely. Elementary age children can understand the importance of the mask and why they need to wear it. They will understand the importance of covering their nose and mouth when they're coughing or sneezing. They understand the importance of hand washing. Singing the happy birthday song a couple different times will also help. And so elementary age children, I think, are perfect target where to begin this. Younger children, of course, we're completely dependent on parents and their ability to help them be protected.
I also have seen people take it off to sneeze. You know, if you're wearing the mask, when you have to cough, when you have to sneeze, I'm guessing it's still probably good even with the mask on to do it this way. But we want to keep it on. That's part of the whole point of it. Isn't that right?
That's right. And so coughing and sneezing, respiratory droplets are being shared. And I intentionally use the word shared. You know, obviously it's being spread. But, you know, certainly coughing within the crook of the elbow, washing your hands after, and absolutely putting that mask back on. It is so important. And I realize it's stressful and can create some anxiety for various individuals. Just the thought of wearing the mask throughout the day can be pretty stressful, even for healthcare professionals. And for those individuals, I would suggest, you know, if they, you know, as physicians, at least in this community, we have a number of medical societies. Metro Omaha Medical Society and Nebraska Medical Association, for example, has offered some physician wellness tips. Employers are also looking into employee and wellness tips as well. I think that's where it can be helpful to alleviate some of the underlying anxiety with, am I doing this right? Oh my gosh, can I take it off to have a drink of water? Am I endangering myself or others? Am I going to be endangered if I don't? So you know, it's such a difficult time for everyone. It's unprecedented for sure.
And we've been told we need to wear those cloth masks. One of the big reasons is to preserve the N95s for medical workers. And I saw a question pop up. It looked like it was from Brian was asking, why can't we all get N95s? Isn't there, CDC has some recommendations on reuse. I know there are some different things being done with.
I'm sorry.
Oh, you can't hear me? Okay. Sounds like Dr. Gordon can't hear me right now. So Dr. Quimby, we will put this one at you. I wonder if we can get her re-going again. But with that, so why can't the N95 just be reused and made public for everyone?
One of the comments that he made there in the live chat about removing with gloves and placing it in a paper bag, that is fine, except the outside of the mask is considered dirty and contaminated. So if you put it in a paper bag, the little straps in the back or the ear loops can easily touch the front part of the mask as well, which is why a flat surface or something where the loops can't move might be better than a paper bag. Why everybody can't have an N95? I hear that question from a lot of people who have never tried to breathe through an N95. They can be exceedingly difficult to breathe through for other than short periods of time. They've studied pregnant women who, I've never been pregnant, but they have they've run into respiratory problems in their late pregnancy, and they've measured the carbon dioxide levels in their blood when they've been wearing a mask after a certain amount of time, and it goes up. You are not breathing as well through the mask than you are without the mask. The other thing about reprocessing often involves, if you're trying to sterilize it, UV light or hydrogen peroxide, which are not readily available in medical grade. Part of the capture of the particles by an N95 mask is by electrostatic charge, which basically just means little ions and stuff. So if you try to wash it with water, you lose that. So your N95 mask will probably no longer be an N95 mask. It'll be a N80, 90, who knows. So that is some issues with reuse of standard N95.
Yeah, I know even for home improvement projects, we've had N95s in the past, and they are not very comfortable at all. They're quite uncomfortable. So I know you guys need to wear them, and we're glad we have them for you. But okay, it looks like we're having audio issues still. I'm wondering, last time it worked when I got knocked out and knocked back in. I don't know if that's something we want to do at this point and have any other questions addressed, or maybe we can wait and see if one is up on the screen. She can address that one. We'll try on that. Dr. Quimby, for you, what are the common questions you've been receiving from patients? What are the questions you seem to hear the most when it comes to COVID-19?
The questions that I get the most are about antibody testing, about medications that are mentioned in the news, about am I going to die, about when things should open up. I can tell you that most people who are sick are not all that critically ill. Some of them are, and some people do not do well, but most people do pretty well. The medications, there was just an expanded use for remdesivir, but that is still under the control of FEMA. So you can't go to your local hospital and say, I'm getting this. One, it's not like Tamiflu, which is a pill, it's IV only, so it wouldn't be useful for outpatient treatment. And it's up to FEMA's discretion which hospitals actually get a supply. Antibody testing is in fairly early stages, and people aren't quite sure which tests are the best and what tests mean and what levels you need to relate to immunity. Those are the type of questions I've been getting.
Okay, and I was knocked out from that for a little bit, but it looks like we have another question that up. It says, my kids are going back to daycare soon. Should they wear a mask? So we know daycares in the state of Nebraska are going to have or have been 10 persons per room. It's now up to 15 people per room. But Dr. Gordon, do you want to take this one? So kids going back to daycare, should they be wearing masks?
I think the reality of a child in daycare keeping on their mask is zero. I think daycare providers will certainly try to minimize and should perhaps look at minimizing where they can the number of children per room to increase distancing. Children who are older and closer to graduating from daycare may benefit, may be able to keep their masks on. It's certainly, if you have a mask available, that's wonderful. But as we discussed earlier, it's very difficult and it's not recommended at a younger than a certain age because it's a choking hazard, ingestion hazard. Daycare providers can certainly minimize the number of kiddos in each room and disinfecting the surfaces frequently, reducing the number of loose toys about the floor, and increasing spacing between children, as well as doing screening questions with parents, both when the child comes for the day and strict adherence to asking those parents to not bring in kiddos who may be sick.
And I think that is a big thing too. I know if, you know, again, with having young kids, I try to tell them what I can tell them of, you know, we don't go and they're not around a lot of people at all, but you don't go up, even when we're on a walk, you don't run up to other people or, you know, run past them, you try to stay away. But if they were playing with other kids, and again, my kids haven't been in that situation, I can't see the mask, but maybe it is, you got to still not touch other people, which even that is a hard concept for young children, you know, when you're playing with toys and whatnot. But to just kind of greet your kid where they're at and see what you can actually manage with them. And I suppose when we're talking about young kids, any step is a step in the right direction, even if it's not full compliance like we hope adults are having.
Agree. I think the other thing I would add to that is daycare workers may want to consider wearing masks themselves, but I think a little bit of talking to with the kids will help them, because that can be scary to see an adult in a room with a mask. And so that will affect their experience with their usual daycare provider even. And so I think the facility would may gain some additional cool points with the kids if they're able to help them understand that there's nothing scary that the provider will be doing to the child. They're just wearing it to help them to stay healthy.
What does flattening the curve mean? Is it trying to reduce the number of cases, or is it spreading out the inevitable number of cases to not overwhelm medical facilities? We've had this question come up at different news conferences and things where people are saying that, you know, it's inevitable a certain number of people are going to get sick. Is that inevitable, or by flattening the curve, are we also reducing the number of people who get sick? Dr. Quimby, could you address that?
The main goal is to not have too many people sick at once, because then everybody does more poorly. So that's the main goal of flattening. So it's actually flattening your peak instead of going backwards. Okay, it goes that high, it goes that high. I think I did that right. Okay. So you have less people sick all at once. But by doing that, you're actually prolonging the amount of time that things are going around. Because if you could get everybody sick at once, it would be, honestly, for the people who like movies like me, the Thanos approach. Boom, it's all over all at once. That's very bad for people who are involved, but then everybody else moves along okay. If you extend it for long enough, then you can take care of the people who are sick, and you might extend it long enough that there could be better treatments, until there could be an effective vaccine, until we actually have a small enough number we can trace people and isolate appropriately, so they don't spread it more. So it might lead to decreased cases overall, but the main point is just to not have too many people sick at once.
Okay, so if I'm understanding it correctly, right, it might lead to fewer cases because treatment is better, and if you have healthcare workers who can tend to people better, hopefully they don't get as sick. So all of that could happen, but number one is we don't overwhelm the healthcare system, because overwhelming the healthcare system obviously kicks a lot of problems into gear. And something I don't want to raise fear factor things. I should say that, you know, that is something that is being tracked by state health officials all the time. And at this point, we're not there, and patients are being moved if needed to different areas. So as a state, we are not overwhelmed at all. Well, individual healthcare workers might be taking on a lot. And yeah, the healthcare system is not overwhelmed in Nebraska. We're doing a good job with that, it seems.
Yeah, our hospitals are in pretty good shape. That's why we've been able to start doing more elective things again. They have that 30-30-30 rule. But overall, for our hospitals in the metro area and out west, we have the last few days right around 100 inpatients with COVID at all.
Oh, you froze up a little at the end. Could you repeat that?
Oh, okay. So our hospitals are in, I don't know where I froze. So our hospitals are in pretty good shape. Overall, over the last few days, between our Omaha Metro and Lincoln and Kearney and Grand Island and our outlying hospitals, the critical access ones, we're averaging about 100 total patients with coronavirus. So that's well under our capacity. And that's why we've been able to start doing some of the less urgent things again.
And Dr. Gordon, we were talking about this a little earlier in the conversation, but with those elective procedures, we're saying, and Dr. Quimby, I think you made the point too, these may be less serious procedures, if you will, but these are still important procedures that people may be holding off on, and they really need that care. Is this something you're hearing, that people are glad that we can return to some of those care needs that they might have been putting off?
Absolutely. Here, when we have seen patients who are now willing to come in to have their pre-op exams completed, they're happy. They're still a little nervous because they're unsure of what the process will be in our hospital system. But as we just heard from Dr. Quimby, hospital systems have taken significant precautions, not only with their staff, but their processes with pre-screening. So our health systems here in town are generally requesting pre-surgical COVID-19 testing by PCR or a nasopharyngeal swab. That should be done about 3 days preoperatively. Some hospital systems are leaving that decision to the surgeon, of course, and we certainly support doing that where we can help to expedite that process.
Dr. Quimby, for anyone, and now that we're opening up testing to more and more people, for anyone who is going to be going in for a test, what do you tell them to expect? I understand it doesn't take very long, but it's not necessarily the most pleasant feeling. So what should they expect if they're going in for it?
One, can you hear me? Because my screen just went to my login screen.
I can hear you fine. Can you hear us?
Okay, that's fine.
You look great.
All right, it went to my login screen. So what you can expect is I can only speak to the experience at one of the CHI pre-op testing clinics, because those are the only ones I know about. But you generally have your appointment time. There's not a whole herd of people there. You're going to show up. They're going to ask if you have symptoms. You're going to have a swab put up your nose to where it feels like it's coming out the back of your head. They are going to put that in the little tube, and then they're going to say, "Thank you very much," and you will move along your merry way.
Why is it important to have more testing? Why is it important? Some people say everyone should be tested. What are your thoughts on that? And whether or not you believe that, why is it important to have a larger sample of people who are tested?
If we had the possibility of testing 350 million people in one day, then epidemic would end, because everybody would be tested. We would know all the positives. They could be apart from everybody else for 14 days or so, and theoretically no problems. That is not going to happen anytime soon. So testing everybody is not really all that feasible. You can have exposures if you don't have too many sick people, because there's only so many tests to go around. Why we're testing people before surgery? Because when you're getting surgeries or other procedures, they're putting breathing tubes in you, and honestly, they're mucking with your body. So you could be putting little particles in the air, and that's why currently for people who are not tested, the anesthesia folk and the surgery folk are wearing the protective hoods or the N95 masks that were mentioned before. Because they don't know who is positive and not having symptoms, who might be positive and have symptoms tomorrow, and we don't want all of our anesthesia people to become ill. If we know that people are negative, then they don't need to use up those masks and other supplies.
Dr. Gordon, as we look forward a little bit, we hear the line that this will not be dealt with completely, well, even then, not completely, but until there's a vaccine. So as we look forward with that, the people who are getting a little fatigued, and we know that's happening with having to, follow these rules and things, what is your advice to them in terms of how to view this? I mean, do you tell people that you kind of got to look at it as a little bit of a marathon? It's going on for a while and life is going to be a little different for a while, or what should we expect?
I think your advice thus far is spot on. When our country began working our way through this unprecedented health pandemic, it seemed to start as a sprint. And as time passed, I think now realize the importance of managing through this as a marathon runner. For those individuals who may be fatigued and maybe more susceptible to wondering, well, is this symptom that I think I have related to COVID? Have I been exposed? Please believe and know that medical scientists are working around the clock to evaluate those tests that will be brought to our communities. We're looking at serologic testing. We know there are issues and they're not reliable consistently at this point. We have learned through medical literature that the FDA has accelerated their evaluation and approval process for those tests that are reliable. I'm sure that we've each at some point received an email about going out to be tested somewhere. I would instead encourage use of the testnebraska.org website. Fill out the form, be evaluated appropriately if it is indicated for you to get that test. We're in for the long haul on this. As we've also heard, development of a vaccine is more than 12 months away. Again, marathon, and we're still learning more about this virus every day. We're now hearing that there's a potential impact with children and how it's manifested. And so, as I mentioned earlier, wellness tips, both as healthcare providers, as employees and employers, as well as for our children, is important to mitigate and get through this. We have to be strategic in our approach.
Dr. Quimby, we still see a lot of people, it seems, commenting, to each other and on social media about how there seems to be this belief that this has been around longer than medical professionals are letting on to. I'm sure you've seen posts like this. What is our understanding of, I know it's not pinned down exactly, but what is our understanding of when this virus started and when it got to the US?
They can do some studies based on genetic drift, how the sequence of the virus has changed over a little bit of time. And if you assume it works like clockwork, like it normally does, because it's a certain set of errors, you can trace back to where things came from. There were probably some cases earlier on here before we knew about it in January. First cases seem to be in the early part of December in China. I've heard that, a year or so ago, the lung disease from vaping that could have been a manifestation of this, I would say probably not, for the simple reason that there were a whole lot of healthcare people and household contacts in really close proximity to those people, and they did not become ill. So I've just mentioned that one, so I thought I would throw that one out there. Probably around there there's probably earlier cases than we're aware of based on some studies now that we can actually have testing, because there were issues testing early on in this country.
So we have a question. Sean wrote in, wouldn't it be necessary to repeat testing on everyone because all will eventually be exposed in contact with COVID-19 even after being tested? kind of brings up what you were saying, if everyone could be tested on the same day, that would help things out. But what's your response to that, Dr. Gordon, of, you know, if we get tested, what does that tell us? Because we could still get sick again or get in contact with people again. Why is testing still, from a medical standpoint, the best way to move forward?
I think, as you heard earlier, so testing, ideally, if we could test everyone, we could separate those who are ill, have them self-quarantine for a particular period of time, and decrease spread to others who are not ill. For those who tested negative and are not ill, perhaps there is shift at the molecular level with respect to the virus and how it presents. To retest folks again, I think we'll be facing the same issue of inadequate testing supplies. And we're still unclear at this point in time if initial infection conveys any immunity, or if subsequent or secondary infection conveys any immunity. There's still so much to know. So I think, you know, overall, wouldn't it be necessary? I would say probably not necessary to retest everyone again. There simply won't be supplies, and we'll have to prioritize those who may need future testing.
There's been a lot of talk, or there's been talk of another surge in the fall. What do you think about that? Dr. Quimby, do you want to start with that? The talk I seem to hear would be, oh, and it could be even worse because it could fall during flu season, is something we seem to hear a lot.
My magic 8-ball's broken. I will say that first off, okay? But most of the respiratory infections tend to be worse in the winter months than the summer months. This one is still capable of spreading in the warmer climates of summer months so far. Maybe not as well, but we're not having issues. I mean, the virus is showing perfect ability to move along in Australia, for example, who is in they're the opposite seasons from us. So there's more respiratory illness at all times in the winter in general, just because of people's behavior. It's colder, so people tend to be indoors more in more close proximity. Windows aren't open as much in homes because it's colder, so there's not as much airflow. And so there can be more spreading along that way. Also, we have had decrease in transmission now because of activities, but as you mentioned, there's fatigue with that and areas opening up. With things opening up, you can expect, if there's still ongoing transmission, to have activities start to increase week, 10 days so after the first opening up, because it's not like everything happens all at once. So part of the fall prediction is that, okay, we're going to be starting to maybe go back closer to a new normal some weeks prior to that.
One question I've had is, you know, when we talk about the healthcare system, it seems that from most things I've seen, states are dealing with cases themselves. Has there been talk in the medical community that you have heard that, for example, Nebraska, since we haven't reached any critical levels in any way, we could ever get patients from other areas? Is that something being discussed, or not really an issue at this point, since states around us also haven't hit critical levels?
We are moving some people locally within the state, and I mean, Western Iowa I'm including as in the state. I mean, they're their own thing. I'm not making fun of Iowa. Okay, but it's technically across the state line. But we treat Western Iowa as often like as part of Nebraska healthcare wise. And we have been moving people around from Grand Island to Omaha area. There are issues when you're going to be transporting long distances. Like, are you going to have somebody on a ventilator in an ambulance for an 8-hour ride or an airplane? That could be a problem. I know that in the last few days, there has been a in-state transfer center in-state transfer center line, set up to move people between the hospitals more efficiently. That was mentioned on the governor's press conference in the last couple of days. And so we are moving people around as we have to, but there's logistical problems with taking people here from, say, Texas. They're just pretty far.
Sure, that makes sense. Are we seeing any other questions coming in from viewers at this point? Looks like not at this point. Are there any other questions, commonly asked questions that either of you would like to address, or any closing remarks you'd like to share with our viewers?
You know, I would like to recommend just to your viewers and our patients that we share in common across this community. CDC.gov is a great resource, both for the general public, for parents with children. There is sound and reasonable and very achievable guidelines that can be utilized there. And certainly there's information there for healthcare workers, of course. I would recommend adhering to looking for information through the reputable sites such as cdc.gov.
Dr. Quimby, any closing remarks for people?
CDC, good source of information. World Health Organization has some information as well. I would just say also keep in mind, this is a learning process for everybody. I've heard people say, well, I don't trust the CDC because they said earlier on, don't wear a mask, and now they're saying wear a mask, so they don't know what they're talking about. It is a learning process for everybody. People are doing the best that they can. And as we learn more about transmission, recommendations are going to change.
Yeah, good advice there. Good resources and good advice that you're right. It doesn't matter how many degrees you have, how smart you are, when something new hits the table, you got to figure it out. We all are learning together. Thank you so much. We really, really appreciate you sharing your time with us, Dr. Quimby and Dr. Gordon. Thank you from the bottom of my heart. We appreciate it. Have a good day.
Thank you. Bye.